Right now, we continue with Expert Tuesday. We're going to be talking to a doctor who's an expert as well. Of course, doctors are experts. We're going to be talking to her. She is all the way in Kenya. She's going to be sharing about her surgery work, her philanthropy work. And one thing amazing about her, she operated her own father. So, wow, we are so looking forward to be talking to Dr. Elizabeth Okemwa all the way in Kenya. Good morning, doctor. How are you this morning?
Good morning. How are you?
We are so glad. We are so happy and honored to have you today on the line with us. And it is cold in Johannesburg, Kempton Park, where we are. How is the weather there?
It's chilly, warm but chilly in, we call it the rural southwest Kenya
Okay.
this morning.
Mm-hmm.
Yeah, it's a beautiful day.
Oh, wow. Beautiful as
Yeah.
you are, I suppose. We are so happy to be talking to you today, Dr. Elizabeth. And tell us about your journey in in becoming a doctor. We know there are a lot of doctors who choose different specialities. And in your
Right.
case, what kind of a doctor are you?
Well, let me start by first thanking you for this opportunity to just have me and to host me on your talk show.
Pleasure.
And also introduce myself. So my name is Dr. Elizabeth Okemwa. People commonly refer to me as Dr. Liz.
Mm-hmm.
I'm a general surgeon by profession
Mm-hmm.
for the last 8 years. Can you hear me?
Yes, we can hear you clearly, Doc.
Okay. So I've been working for 8 years as a consultant in general surgery at a hospital in Bomet called Tenmek Hospital.
Mm-hmm.
But by and large, I've been a medic for the last 15 years of my
Mm.
life.
Wow.
Yeah, so my specialty is we call ourselves general surgeons. So I have not super or subspecialized. I generally work and operate on anything from the head to the toes,
Mm-hmm.
anything that walks our way, whether it's trauma, accidents, the head and neck. We talk of the thyroid in front of the neck, anything. People get cuts,
Mm.
breasts, the cancers and the non-cancerous diseases of the breast,
Mm.
the abdomen, and intestines or in any organ
Sure.
within the abdomen,
Uh-huh.
and even the limbs. So we have a common disease, chronic disease called diabetes. So when people
Mm.
get infected, they get like the diabetic foots and they get
Mm.
referred to us to treat them, to treat their wounds. And sometimes we have to amputate, unfortunately.
Sure. Yeah. Wow, Doc.
Yeah.
You sound like a dedicated person, and I see here you also offer compassionate care and personalized treatment plans. But maybe before we come here, how did you identify the journey that you're in right now when you were still in primary school and then you went to high school and then varsity? Did you have you always known that you are going to be a doctor, let alone a surgeon?
Oh, that's a lovely question. I think I've been reflecting a lot on just the kind of tying the ropes backwards right now.
Mm.
And so it's 7 months now. I recently lost my dad, but then it's just been a reflective period in the last 7 months, I would say, just looking back at everything.
Mm.
So I owe it to my parents. I think I owe it to them because they so when I was a child, I think way from my early younger years, we were raised in a big family.
Mm.
I come from a family of five, but then our house was always full of relatives. If you're an African, so you live with your aunties, you live with your
Mm.
cousins.
Mm.
But from a young age, I did notice. So I would call myself a millennial. So I came from a time when at my young age, HIV AIDS was really strong and there was
Mm.
a stigma to it.
Mm.
And I remember my uncle got so I had two uncles that I loved very much.
Mm-hmm.
One of them got deported from the States, and
Mm.
at the beginning I did not know why, but when he came back, he was very wasted and very emaciated. And he had this room that we kept him. And at times, we were told we don't share his cups. And I loved him. So I kept on wondering why we're not sharing cups. There was a stigma with just sharing utensils. And I had a good time with him when he came back to Africa, to Kenya. But he didn't stay. We stayed together for a month. He went to hospital one time. And the next minute you're told he's not alive anymore. Second lovely uncle, the same thing happened. And I had aunties who, when you ask in retrospect, you're told they died of HIV/AIDS, and we've kind of grown up with their children. So my parents, having that burden of raising siblings, and just brothers and sisters who had HIV/AIDS, set up an organization called the Harvest of Hope Self-Help Group in Mombasa. That's where we come from. And in that group, we did a lot of community health outreach to people living with HIV/AIDS, just raising awareness about just breaking the stigma, helping mothers who are left with children just come up with income generating activities. So teaching them how to do fabrics, tie and dye, how to make soap, things that I've carried with myself until adulthood. And then a lady from London came to the same place we lived. She joined us, but then she had this thing called homeopathy. So homeopathy is not the science medicine, but it brings in a natural aspect. So at 16 years, I was being taught how to make a diagnosis, how to treat the colds with just natural medicine. But at that time, I realized I loved interacting with people. I loved interacting with community. So I knew that in as much as I loved math, I wanted a one-on-one with people. I loved seeing people getting better. I loved seeing people be happy.
Wow.
And for me, that became a passion. To just go further. So at 18, I wanted to do medicine. I got a calling to do nursing initially. I wasn't happy, but then my parents were gracious enough to put in some money and just invest in my medical training. So that was, I owe it to my parents. I owe it to them for, not in any bad way, just for allowing family to stay with us and just doing the little.
Absolutely. And deepest condolences, man. We are just losing her there. We're talking to Dr. Elizabeth Okemwa, all the way from Kenya, and she's our expert teacher today. We are just losing her a little bit. Doc, are you still with us?
Can you hear me?
Yes, we can hear you now.
Okay, great.
I was saying deepest condolences from the talk here in losing your loved ones, especially your dad as well. And talking about your dad, we know that you once operated your father. How was it, going into that theater room, knowing that this is the person who is your father, and anything could happen, afterwards? Where did you get the strength from to take the call and the role to say, I'm going to be part of the team that is under the knife for my dad?
So I got the opportunity to operate on my dad twice, actually.
Okay.
Right around post-COVID, he went for his vaccine, and I think he was very gracious. He said he was happy he went for the COVID vaccine because then they noted he was anemic.
Okay.
And the moment I got the call, that was 2020, your dad calls you and he says, hey, I'm from the hospital. They say my blood is low and I've been noticing that my stool is black.
Okay.
I remember that statement from 4 years ago. And, as a medic, as a surgeon, you just start thinking of everything that can make the stool black. So I told him, I think you need to get you need to get a colonoscopy and an upper. You need to just get checked, look at your intestines with a scope. So my home is in Mombasa. I work 12 hours away, so in Bomet. And so I told him, I linked him up to a colleague who was able to do the endoscopy and the colonoscopy. And right after he was done, I think men are really resilient and they never want to be told. I think he knew there was something wrong. But I asked him, hey, send me the images because the doctor was taking a while to talk to me. Just send me what he showed you and send me the imaging that has been done.
Yes.
And right from the point, I just saw everything. I just knew this needs to be operated on. So he was a champion and a colon cancer survivor. So I just told him, you need to be operated on whatever you have. Just looking at the images, it's still early. We will work as a family with my brothers. We'll get you to Tenwek. We'll organize for everything. I talked to my colleagues who are really, really gracious. And we went through the plan. I have an amazing team that works with me. So I just asked one to operate with me and operate together with my students. So in Tenwek, we have a surgical training program. We train students for masters in surgery.
Yes.
So the ability to just have your students also be part of you as you work. So on this time, it was my dad. He came, we took him to theater, and I think the most humbling thing was just having my mentor and my colleague, Dr. Rega, just asked me, hey, just come in, let's agree. So of course they prepped him, they covered him well, decently. So all I was seeing is what we normally see, which is the intestines. And we agreed that this is where the cancer is, surgically and following protocol. This is what we will remove. Are you happy? Are you happy? We're happy. Let's operate. We anastomosed and they closed, and I took care of him the first time. He did really well. The 3 years going through, he went through surgery pretty well, went through chemo, which took him down. Again, my colleagues in Mombasa really struggled with the adverse effects of chemotherapy. He got some toxicity. They were giving up, and I told them, it's okay. I'll just bring him back to my hospital. We'll try our best. He made it through grade 4 toxicity, secondary to the chemotherapy drugs. Went back home, and the last time, which is going to be 1 year in August, he calls me and they're having this beautiful lunch. You can tell when someone is eating really well. I can tell. And the next evening, my mom just calls me and she tells me, your dad is in a lot of pain. He's on the floor, he's throwing up. So as a surgeon, you just start thinking of the differentials. And I knew what he had. So I told them, you need to go to hospital. And if they don't treat you, you need to go to the next, like a higher level hospital. And when I was called, I was told he's in ICU, he's on oxygen, his heart rate is really high. So I asked for time away from my work. I took a bus overnight and I went, and I still knew the diagnosis. But this time it's really sad, and I'm on radio. It's sad when you as a doctor know what the patient has, and this patient is your dad, and you're in a different hospital and there's nothing you can do. And time is ticking. So on this time, I just in weighing everything out, it was a holiday season, the flights were full. I asked my group of medics the year that you graduate with, I asked them, does anyone know of an ambulance? So we took an ambulance from Mombasa to Bomet, 12 hours away, with a really sick patient. And when we got to my hospital, we We gave him fluids, we resuscitated him, and I took him back again to theater with a colleague who was my student. And it was almost midnight. And what do you do? Let me ask you, what do you do? Do you sit outside and wait in the outside in the waiting room, or was it easier for you to be in the room? So for me, the anxiety, I just said,
Uh,
let me just be in the
in
room.
the room. I would also want to
And
be in the room. You know,
yes,
if the worst happens, at least I get to
yes.
experience and probably
Hmm.
find closure. I don't know. People are different, but I'll
Yeah.
also be in the room.
Yeah. So picture that you're in the
Mm,
room
mm,
and you're negotiating with God.
mm,
And
mm.
so they open him up. So they're cutting.
Ish.
They open up. So you're saying, God, please let everything be okay. Let
Mm,
nothing be bad. Let nothing be dead.
mm,
So
mm,
people are trying to keep a strong face, and then
mm,
you start seeing some dead things. So at that point, I
mm.
just said, you know what? It's even harder to be in the operating room and
Okay.
not scrubbed. So I
Yeah.
just said, just not to have the anxiety
Mm.
outside. Let me just
Be
scrub
inside.
in
Yeah.
and and find strength in just being with the team.
Mm, mm.
So yeah, so I scrubbed in. Scrubbing is just where washing and wearing the theater scrub, the
Okay.
gown.
Yeah.
And we now open up, and what you feared 2 days ago,
Mm,
3 days
mm,
ago, is
mm.
what you're
It's
seeing. It's
becoming
dead.
real.
A lot
Yeah.
of it was dead, and we had to
Mm,
cut that. We had to remove
mm,
a lot of dead small bowel.
mm,
And that led to he did well.
mm.
It's there's a high risk of dying even in theater or just around that
Yes,
time,
yes, yes.
but he did well. It's chances of surviving is always 50-50 or more
Mm,
in
mm,
ICU, but just the quality of life also is not as good. So we did struggle. I took care of my dad together with my colleagues. You know,
mm.
you're a daughter,
And
you're
you're a
his
doctor.
consultant,
Yeah.
you're sitting with your mom
Mm,
or your aunts, you're in ICU for 6 weeks. We were
mm-hmm,
there for 6, 7 weeks,
mm-hmm,
just battling every sort of complication. Some did not
mm,
come, thank God.
mm.
And we were able to get out of hospital, but not lucky enough to get out of my house. So
Ish.
I spent maybe a month of just having him in the house,
Mm, mm,
trying to see whether it was he was going to go home.
mm,
Yeah, so I think it's a privilege to be able to do your profession,
mm.
but I think it's a greater privilege to be able to offer the same to your family,
Yeah, absolutely. Yo,
to the loved
what
ones.
a victory
Mm.
story, Doc, that you have just shared with us right here. We just wanted to pay some bills. Please stay on the line. We're coming back shortly to you. Welcome back to the Talk Hashtag Expect Tuesday with Dr. Elizabeth Okemwa, all the way in Kenya. Doctor, are you still with us?
Yes, I am.
Thank you
Thank you.
so much. We see that you've done amazing works in terms of your leadership position. I mean, at one point you were a fellow American College of Surgeons, and then you became a chair lady of Surgical Society of Kenya Infection and Prevention Committee. How have you managed to align your calling as a doctor and also stand a great position to be in leadership?
That's a great question. I think a lot of these things intertwine as you grow in the surgical field. So there's a actual part of practicing in theater, and
Mm,
there's a part where you see patients. But when you look at surgery as a profession, a surgeon plays a big role in being a team leader in theater, in the institution that they work, in
mm,
the clinics that they lead. So leadership doesn't come naturally. I think you still have to work at it,
mm,
but you have to be ahead of your game. So a fellow of the American College of Surgeons comes as a membership or a collegiate part of collegialism and professionalism. So it's one of those accolades that you get as you climb up the ladder, as you want to be a member of all these organizations that give you credit. The Surgical Society of Kenya is an organization within the country that supports and embodies all the surgeons within Kenya and the surgical subspecialties. So together with the Surgical Society of Kenya, I noticed, or when we started our training in Tenwek Hospital under the College of Surgeons of East Central and Southern Africa, COSEXA, and also associated or affiliated with the Pan-African Association of Christian Surgeons. I noticed that within Tenwek Hospital and our subset of our trainees, we had a lot of female surgeons training, basically because we embraced each other and we are founded in Christ. So it was easier. I had mentors that had gone ahead of me who were surgeons and people that had gone through school, almost similar schools like me. So I knew that I loved theater. I loved blood. So I just wanted I can't get to believe that I get paid to do surgery, but a lot of people have questions and wonder, well, as a surgeon, can I have a family? As a surgeon, will I be able to get married? How do we support each other? I got my first baby as a third year in my master's training.
Okay.
And how do you get the time off to just, kind of have your maternity leave? Yeah, are there, just breastfeeding rooms? Are there lactation rooms? Is there provision for allowing you to grow and thrive? So that's when we formed the Kenya Association of Women Surgeons in Kenya. And I was the founder and the chair lady, and I pushed, we created a WhatsApp group, and then we went to the Surgical Society. And now it's a running program. We work together with Women in Surgery Africa, which is under the COSEXA, and Association of Women Surgeons, which is within the American College of Surgeons. So I think if you see a gap, and once you notice the gap and you want to spearhead that, then you naturally become a leader. If you see a challenge somewhere and you take that step and you're willing to push people or fight for a cause, it just pushes you to want to do more, want to do better. So I think that just is part of how I was brought up.
Wow, beautiful. And you also mentioned that one of the foundation of this organization is Christ. You mentioned Christ in it. How important is your faith connected to the career that you do right now? I mean, if you are a believer of God, we all know that the breath that we're taking, it belongs to God. And anytime He can decide to take that breath, how do you align your work and your faith at the same time?
Well, what has come to mind as you ask that, for me to live is Christ, right?
Amen. Amen.
For me to live is Christ. I am because of God. I think as a human being, we are limited. We don't breathe. I don't breathe any air in any patient's life. I am just given the ability to go through school, get the knowledge, and with the ability that I have to offer you a procedure that will either make you well, knowing that I also have to talk to you on the possible outcomes, which can be good, they can be bad, and there can be complications and there can be death. And to be open enough and vulnerable enough to sit with you and your family and to have those discussions and to pray with you before we operate on you and to thank God even as we prepare and even afterwards, and to still come back to you even when things are bad and say, we really have tried, but you know what? We are limited. God is ultimate in everything we do.
Amen.
And I think there's no easier way to say that than me just standing even with my dad and asking my colleagues, did I do everything? And if I did
Mm,
everything in the eyes of God, how
mm,
do I help my mom and how do I
mm,
help myself walk through letting go and say
mm,
he's going to a better place? And though we find it hard, we know that there's a better, like there's a better glory. These are just
mm.
physical bodies. Yeah, yeah.
Wow, beautiful. Thank you so much, Doc. And for people that are in Kenya who are listening to you, where can they find your premises for your services?
Well, so I live and work in Bomet County, currently
Mm-hmm.
in Tenwick Hospital. They can reach out to me. I do have a website running, and
Mm-hmm.
that's more based on just a passion to reach out to anyone who has any need or wants to reach out in terms of just either consultation, mentorship, coaching,
Mm,
guidance on what they want to do in life.
yeah,
I do have patients who've become friends and who just even come to a school that I set up to come and visit
absolutely.
and just let me know that they're doing well.
Wow.
And I have an email address and yeah, just I'm on LinkedIn and on Facebook.
Mm,
And I think sometimes we all validate each other. So just someone who
mm,
says, thank you for what you're doing. Or, Doc, do you remember that I was in
mm,
that bed and you hugged me and you said it's okay and you prayed with me?
mm.
And that means so much.
Wow.
Yeah, yeah.
Wow, Doc. Thank you so much, Doc, for sharing, spending some time with us and getting us information on your expertise this beautiful Thursday. We wish you all the best. We can't wait to see you going international as well. Um,
Thank you.
in your organization, we're really proud of the work that you're doing and the wisdom that God has placed in you, and you're absolutely using it accordingly. Thank you so much.
Thank
Yeah.
you. I'm truly humbled for the opportunity, and it's just such a pleasure to have this talk with you.
Yeah. Enjoy the rest of the day, Doc, and all the best, like I said. Thank you so much.
Thank you. Have a good day too. Bye.
Thank you. That was Dr. Elizabeth, all the way from Kenya, and we were talking to her today in regards to our Expect Tuesday. Don't forget to follow us on our socials. We are Hope Alive Radio on Instagram, Hope Alive Radio Station on Facebook and TikTok, and to connect with us through talking to us on voice note or a text, send through to 067153 089. And Olimwango is coming with a beautiful one. They're saying healing power.